Welcome back. It's now 7:38. As January comes to a close in the next couple of days here, February's focus is on heart health, as it's National Heart Month in February. In fact, this Friday is National Wear Red Day in honor of Go Red for women to raise awareness about heart disease in women. It's actually the #1 killer of women in the United States here. It's also a leading cause of disability among women, and the risk of developing the disease increases with age. Joining me now this morning is Dr. Christine Zirafi. She's actually the Medical Director of Cardiac Catheterization Services at Parma Community General. Doctor, thanks so much for being here this morning.
Thank you.
I guess, we were talking about that, the #1 killer of all cancers combined for women. What are women doing wrong?
Well, it's not only women, but men and kids. Over the past 50 years, we've developed unhealthy lifestyles.
Yeah.
Less activity, eating more processed foods.
Sure. I mean, when it comes down to it, is it that simple? We're choosing the wrong things to put into our body, and we're not moving around enough.
It really is that simple. The inactivity and the obesity epidemic have led to an increase in people with blood pressure, diabetes, high cholesterol, all of the risk factors that do cause strokes and heart attacks.
Yeah. What are some things that people can do? Obviously, you have to change your diet.
Changing our diet is important, and you don't have to get all fancy and look for organic foods or things like that. We're trying to have a push to say just eat locally, because the more local food you eat, the less processed it is, and the more healthy it is for you. Obviously, also, we've adopted the 10,000 Steps program that's been put out by the American Heart Association just to try to get walking into your daily lifestyle.
What is 10,000 steps?
10,000 steps is roughly correlates to about 4 miles, and it's where we want to try to get people to walk as part of their daily activities, and that's what we've lost through urbanization. So if you're at work, get up, walk around if you can, take some walking breaks, and then just go out in the morning or at lunchtime or in the evening and walk. And if you can do that, that really improves a lot of your risk factors and the profile for disease.
And I think a lot of people too, when they think about that, about walking and just eating a little bit better, I mean, it is so simple, but just getting up for that short amount of time to get a little exercise in, I mean, does that really make that big of a difference?
It really does. We've found that through multiple studies, and it doesn't matter what age you are. In fact, the latest research shows even in your 50s, if you can just control your blood pressure, your cholesterol, and your activity, you can markedly decrease your chance of having a heart attack.
Sure, and just being aware of, well, your blood pressure for one, your cholesterol, that sort of thing, just having an awareness about some of your information, I guess, is key. Are there different groups or sessions, if you will, where people can get their blood pressure screened, that sort of thing, around Cleveland?
Yeah, I do know multiple hospitals offer that. Parma Hospital offers screenings every Wednesday at their health center on State Road, and it's important to know your numbers, your blood sugar, your blood pressure, your body mass index, which is a correlation of your weight and height, as well as your cholesterol, and in particular the good cholesterol or bad cholesterol fractions.
We certainly will be talking about it in the media over the next month as February's National Heart Month, and get the message out there. So Dr. Zirafi, thanks so much for coming in this morning.
Thank you.
All right, thank you very much.